Well, hello. I have an interesting practice for you all to try that might feel a little bit awkward or just weird or just plain different, very foreign. So, essentially, for most of us, and I'm going to go ahead and speak to the women out there, most of us have been told for a long time in our life, like since we were little, that you're supposed to like sit up straight, stand up straight. And with that comes this kind of tucking, squeezing, squeezing the core, cinching our waist, and just kind of this like constricted pattern has developed in so many bodies. I've seen this, gosh, day in and day out for like 17 plus years. And so what happens is that we end up struggling with chronic back pain, hip pain, pelvic pain, oh my gosh, bladder issues, bowel issues, belly bloat, like basically anything from here to here starts to kind of wave the white flag because these tissues are like, help, I'm being squeezed too much. They lack the blood flow, the circulation, and just the life force when we're always kind of tucking and squeezing. So it can feel really humbling when you have somebody like I'm doing right now to actually invite you to try to inhale and let the belly go, and almost allowing your belly just to get soft and to expand and get big. Again, this might sound really, really foreign, and it might even feel very difficult when you try it. I recently led a workshop where there were about 5 to 6 women, all in their kind of 40s, 50s time frame or age range, and every single one of them said, "Wow, this is really hard because I've been trying to suck and kind of tuck everything in for so long." And most of them have been struggling with any, certain bladder issues, belly bloat, constipation, back pain, all despite like hitting the gym and trying to eat well. So this kind of sucking in pattern can really be a really big deal for the body. So this is something that I call the marsupial hug. So if you imagine a little mama koala and she's got her little pouch and she's got her little young in there, the marsupial hug is a really nice practice to try to kind of let the belly go, like let your abdominals off duty. So I'm going to show you my belly. And in this hands and knees position, you can see that my hands are underneath my shoulders, my knees are underneath my hips, and I'm gently active. So I'm not kind of slouching or falling with gravity at this point. I'm just gently active. So from here, I'm going to gently inhale and allow my belly to expand and fall as if I'm going to let that little baby koala kind of hang low towards the mat. So my belly gets big and expands, and I'm going to exhale and hug that imaginary koala back up towards my spine. Gently active at best there. Inhale, let that activity go. Let the baby koala hang. Exhale, gently engage that baby koala back up towards your spine, like you're hugging it back up towards you. Inhale, let baby koala hang. Belly fills, it hangs, it gets big with gravity. You just let gravity take it. Exhale, gently hug that imaginary koala back up. I'll do one more. Inhale, let it hang. Exhale, gentle hug back up. So a really nice practice to try, even if it feels a little bit hard or weird or foreign, but can be so helpful for the bowels, the bladder, the digestive system, all of the musculoskeletal tissues, abs, low back muscles, hip muscles, pelvic muscles, and all of the fascial tissues and nerves. Like literally there is no tissue in our body that doesn't benefit from that practice. So there you go. Try it out, see what you notice, and drop a comment if you're feeling brave to do so. Enjoy the marsupial hugs and that expansion of the belly.